Okay, there we go. It's preparing the live stream right now. Let me look on here and see if I see it. There we go. Live. Yep, there we are. Welcome, welcome, welcome everybody to the VBF Vascular Birthmarks Foundation December 2023 Facebook Live with Dr. Giacomo Colletti, our international expert, also our VBF Italy medical director and our VBF Europe medical director, and my VBFF, vascular birthmark friend forever, my favorite surgeon. So I can see that we are live, and I see some people are already on. So when you come on, please say hello, tell us where you're from. We will be live for 1 hour. Dr. Colletti will be answering. Hi, Robin. How are you? That's Robin Duarte. Let me just see. I want to see questions. Oh, sorry. Here we go. So I can see the questions. There we go. Hi, Dr. Linda and Dr. Colletti. Gina here. Hi, Gina. Merry Christmas.
Hi.
Merry Christmas.
Merry Christmas to you too.
And again, this is a little bit of a unusual time slot for us. Although when we did it the last time you and I did it from Italy, I don't even know what time. We must have done it at a similar time to be able to.
It was probably 6 here, so noon in
Okay, so that might have been what it was. Okay, so I see we have more people coming on. So again, say hello to myself and Dr. Colletti. I can see Gina, and I see there's more, more and more people are jumping on. Dr. Colletti is here to answer all your questions, all things VBARS. We were just talking before I went live about his new procedure for treating arteriovenous malformations, or what I affectionately call the AV monsters.
Yes, they are indeed.
And you agree with me, right?
I do totally.
Yeah.
Actually, as I told you before, I have now 2 new strategies, which is, we have this staging system, Linda, you have contributed to it, the SEC-G staging. So when you have a small peripheral AVMs, then you can and should, in my opinion, go on and remove them, being surgically radical, which means in my hands, relying during surgery on an ultrasound device to be safe in terms of margins. But when you have more difficult ones, especially the ones that affect a lip, for instance, which may not necessarily be huge in size, but the location is critical, because surgery there would mean resecting part of the whole lip. And this would be disastrous in terms of function and aesthetics. So the new strategy, which we will be probably presenting at the next ISPA meeting, is called the sandwich bleomycin procedure. And what we do is we prepare the field with bleomycin, and we check with the ultrasound that we have sterilized the area. Then we do the surgery where we just remove the bigger vessels and remodel the area so that the endpoint will be a normal appearing lip or ear, whatever you mean it. And then we finish with more bleomycin to be sure that we will not have any relapse of the disease. And this, I'm about to publish it. We have done 17 patients up to now, and the results are just incredible, unbelievable. This is my new standard for small S3 AVMs. On the other hand, when you have major AVMs where just bleomycin would not be enough, because you would need like a gallon of bleomycin to manage a widespread arrive AVM. So in that case, we have this new technique which I have developed, and Dr. Linda strongly contributed to it. And then we do this modified electrosclerotherapy because my technique is different from the one that other people in the world use for low flow malformations. Usual electrosclerotherapy will not work on diffused AVMs. And again, we are observing, and you can testify it, Linda, amazing results where we are able to manage the disease with electrosclerotherapy and then do reconstructive surgery to get back to a normal appearance. It's amazing.
Thank you for that. And we're getting more and more patients, quote unquote, classified as CM AVMs that I see going into this whole niche group for this, because the tendency is to want to laser the heck out of them. And we don't want that, you know?
No.
So I think that's going to be your next big project is, first of all, we need to reclassify these CM AVMs as a stain that is a result of the architecture of the AVM.
Actually, at your meeting, the last one, Dr. Paula North, a strikingly expert, a pathologist in the field of vascular anomalies, showed us specimens where it is clear that the skin staining, it's not a capillary malformation. It's just an epiphenomenon of the underlying AVM. So would you laser on AVM? I wouldn't, because if you know the biology of that beast, you know that any event that can cause hypoxia, and laser is one of those, will trigger hypoxia in the interstitial tissues. So that will in turn cause a release of angiogenic factors that will stimulate the AVM, which will respond by expanding and potentially decompensating with local complications such as ulceration, pain, infection, bleeding. I strongly recommend not to do any laser on CM AVMs.
Agreed, and I'm glad that you said that, because we'll be driving people to this video from this December of 2023 when they start saying, you know, my kid has a CM AVM and the doctor wants to laser it. You gave a perfect explanation for that. Thank you. We have quite a few people on from all over the world saying hi, from Georgia, Canada, Romania, United States, a number of your patients, but we're not seeing any questions. It doesn't matter what the question is. So
don't be afraid. Just ask.
Yeah, I mean, you know, this is your chance to ask Dr. Colletti live a question. Hi from Italy, Ahmed Marabi from Italy.
Yeah.
So I'm not sure.
I think we met him at our last meeting. Yeah, last super clinic. Yeah. And he's been, if I am not wrong, he's been sending me an email just today, and I'm about to answer him. But okay. I will answer you online. So I will try to give you the best literature in order to understand your disease. And as for our treatment plan, I have two things I can offer you. The first and most beneficial, in my opinion, would be to remodel your overgrown soft tissues. So a lip recontouring, probably a bone remodeling in your maxilla and nasal bones, so that your profile, your volumes will be even and your face will be symmetrical. Then we will work on the stain itself.
Thank you. So actually we have a question from Scott. Now he's saying his pyogenic granuloma is back for the 4th time. And he said, I know you recommended a procedure. Can you speak to this a little? What are the risks?
So pyogenic granuloma is not fully understood. Okay, this is the first thing we have to say. And you have it in the context of a capillary malformation. Some pyogenic granulomas will behave like benign tumors. So when this is the case, you have to resect it surgically and not leave any part of it behind because it will recur, okay? And this is one type of pyogenic granulomas that can appear in the context of a capillary malformation. The other one is a reactive phenomenon to any form of irritation or infection. So it's an exuberant reparative process, which when it happens in the gums and in the periodontal spaces, most likely is being caused by some periodontal disease or microbic contamination of the periodontium. So when you remove a pyogenic granuloma in the gums, you will have to very thoroughly clean the periodontal spaces and be 100% sure that you did not leave any triggering cause behind, such as even minor, germs, pockets, yeah. So that's how, in my opinion, has to be addressed. And then after the surgery, I usually recommend a course of local timolol, because there is evidence that beta blockers can delay or prevent the recurrence of pyogenic granulomas. So this is my...
I heard Dr. Cohen speak about that.
Yes, yes.
Well, we have a lot of
literature.
questions. Yeah, we have a lot of questions coming in, so thank you for that answer. So Robin is saying, I'm curious if this is why my blebs don't go away and just get larger and spread out when lasered. They never go away as expected. I think she was responding to maybe she might have a CM AVM, like why do these blebs keep coming out? So
I'm not sure. She may be referring to the nodules, the cobblestoning, that happens in capillary malformations. They will not respond to PDL, so the dye laser that is usually adopted to treat capillary malformation, port wine stains. These need to be resected, so removed surgically, or can be managed with other kind of lasers, which are more aggressive and totally comparable to surgery in terms of like aggressiveness. If you are talking about CM AVMs, then unfortunately, the laser is triggering an expansion of the AVM, so I would immediately stop it.
Okay. Daniel has a great question. I can't wait to hear your answer. He has just been told that his KTS is from a PIK3CA mutation. He's 36 years old, and he wants to know if you've seen any positive results with alpelisib in older patients, and he said his symptoms are mainly vascular.
If your symptoms are mainly vascular, then definitely, yes, you will respond to alpelisib. Alpelisib is especially effective in PIK3CA positive vascular malformations in general. And since KTS, if it is a proper KTS, has a mixed component of capillary venous and lymphatic malformation, then they will all respond to alpelisib, and also alpelisib may make feasible some surgery on the leg. So if you were my patient, I would definitely try it. Just one thing, alpelisib may cause some raise in your glucose, plasmatic glucose levels. And a doctor, one may think if you have diabetes induced by alpelisib, then you should give insulin to a patient, right? Well, short answer is no, because PIK3CA is an insulin receptor. So yeah, so if you do give insulin to a patient who has a mutation into PIK3CA protein receptor, it will stimulate the activity of PIK3CA, so it will inhibit the inhibitor. You know, so the solution there is ketogenic diet, not insulin.
Very good. Great question from Dustin. His nine-year-old son has several intramuscular venous malformations. He's 9, so right at the cusp of puberty. His left thigh venous malformation has not been giving him pain, but he's begun limping and walking on his tiptoes, and he's 9. How should we proceed to correct this?
Okay, so if your son has several venous malformations, then there's the chance that he has a germinal constitutive mutation into the TEK gene, TEK, or the PIK3CA. And you should test this with a small biopsy and gene testing the whole blood. Because if this is the case, then the management is different from the one that you do on a pure sporadic venous malformation. Regardless, when I have to manage multiple venous malformations, especially in the extremities, my choice is to use electrosclerotherapy. Why is that? Because you can manage all of them with plain sclerotherapy, right? You can do that, but you are dose limited. With electrosclerotherapy, the amount of bleomycin you administer is the same. And then with the probe, with the handpiece, then you manage all of them in just one session. So this is why electrosclerotherapy is my favorite technique in while managing multiple venous malformations, especially in the extremities.
So then actually, how good is that? Because you now have a low chance of reaching maximum amount of the sclerosis, which is like you said that even before, there's a lifetime limit on how much you can have. And so you gotta be precious with using it. So this electrosclerotherapy is a game changer, because I mean, the fear is still there. You still have to keep track, but it's not so prevalent.
You know, I think that one should understand not the physics of how electrosclerotherapy works, but the dynamics of how it works. So the end point of electroporation is that by allowing bleomycin to penetrate better, easier, and faster into endothelial cells, you will enhance its effect by at least 100 times. This means that when you use 1,000 units of bleomycin, you're actually having the effect of 100,000 units. You know, so this is why you can use much smaller doses or the same dose to treat way bigger areas or different regions in the body.
Okay. So Liv McGregor writes from New Zealand, and she has a daughter that has a port wine stain on her face and her neck. She has had 10 laser treatments and is 8 months old now. So bravo that
Yes.
that mom has gotten in 10 treatments and she's only 8 months old. That's wonderful. She said, we're taking a break over summer until she's 11 months old. That's a 2 months break, 9, 10, 11, 3 months, because the doctor's going away. When we start again, how long would you recommend between treatments? Right now, we've been doing 2 to 4 weeks, but think it may be longer once she's older.
No, I would, well, I totally favor what your doctor is doing. That is my, the same protocol I follow. So the shorter the poses, the better, for many reasons. But one that you should always bear in mind is that one should try to finish, complete the treatment before the baby is old enough to remember what he or she is being through. So, and this means usually is age 2. Okay. So if you are starting back again at 11 months, then you should resume treatment just exactly as you did before, and ask your doctors how he or she thinks things are going, and how many treatments he or she anticipates he or she will need before considering the treatment finished.
Thank you. The next one's going to be a little difficult. I'm going to try to read it to you. I believe it's in Spanish. So she's saying, mi hija tiene una malformación vascular en su lengua, ya ha sido operada, pero la vuelto a salir como huevitos de rana. Esta tomó 2 cereales, pero no vio resultado. Dice cómo me pueden ayudar.
Gracias por tu pregunta. Yo creo que puedo ayudar, pero necesito ver las imágenes y algunas fotografías. Solo cuando yo he visto, oído las imágenes, puedo decir algo. Tú puedes preguntar mi email, la puede buscar en internet, me puede escribir una mail, yo voy a hablar contigo después.
Gracias, gracias, gracias. So Hamed, I can answer you. He wants to know how he can continue with treatment. Dr. Colletti was going to email you after this, so he'll get in touch with you so you can let him know about proceeding with treatment with you.
Yes.
So Claudia Austin writes, Aurelius got some good news today. His limb length discrepancy is within normal. Previously, his leg with large port wine was 2.5 centimeters longer than his other leg. Wow. So I'm wondering if what Claudia is saying, because Claudia didn't write before, I don't see anything from her. But Claudia, are you saying that he's on the medication? Maybe that's what she's saying, and that
Probably.
I'd like to know that, Claudia, because if there was a discrepancy and now there's not, I haven't heard of this, that an actual limb discrepancy is more normalized. So write whatever that was that you're trying to say, Claudia, so I can understand, like, you got this good news, but what happened? What was the treatment? The next one is from Jane O'Keefe. I'm 68 years old. I have a port wine stain the size of half of a mustache above my lip. It's never been treated, but it's become very dark. It has not thickened. Is there any treatment that would help at this point in my life?
Definitely. Laser will help a big deal. So I don't know where you are based, but if you need something, you can contact me. But try and find someone nearby you who can help you with laser.
Right, and they can go to the VBF website at birthmark.org,
Definitely.
click on the Find a Doctor button and put in your country or your state and see who's closest.
Definitely.
Mari Hani says, hi, Dr. Colletti. My 2-year-old has a port wine stain on her arm. We met you at the VBF conference. She has a few scars, dark spots from laser burns. Is there any anti-scar medication available to lighten these scars? And how long should we avoid lasering that area? It's been 12 weeks.
I usually recommend silica-based gels and massage. That's the best thing you can do if there
Did
is
you say silicone based?
not silicone, silica.
SILICA, so silica?
Yes.
Okay.
The cream I usually use is Strataderm, STRATADERM.
Strataderm.
Yes, that is a gel that you apply on the scar and you massage it. The more you do it, the better. That will not necessarily help with the color, but that usually fades away with time. There is not really a need to suspend the treatment, the laser. You just have to avoid those areas.
Daniel said he has one more question. I have multiple evulsion surgeries. Oh, that was for the KTS. Do you think they're beneficial for KTS? It seems to change the situation rather than improve it. For example, I got more superficial clots, new aches, but a slightly looser feeling leg. I've never had superficial clots prior to this evolution surgeries.
I don't know. I would need to see you and to visit you before I can express myself on this, which is a little weird, odd.
Well, he can send you records. He can
Yes.
email you. Our staff will post Dr. Colletti's email in the string here, so you can. By the way, this video will be live right after we finish. So this is 1 hour. We're already halfway through. We have another half hour. Then it'll be live. It'll live forever on our Facebook page, on our website at birthmark.org. So you can go back and re-listen and look at it and share it with as many people as you want. So you can also write, you also see
So I better not make any mistake.
well, we have all of them from
Kidding.
I did in January 2017. We have every single one. These are invaluable resources to individuals affected by any kind of VBARS, or vascular birthmark anomaly or related syndrome. You can go back and watch the Dr. Nelson's videos with laser, or Dr. Geronimus, or the surgeons like Dr. Colletti or Dr. Rosen, the radiologist, Dr. Comey on Sturge Weber. Go back and watch these over and over and you'll get your questions answered, which is why VBF offers these services for free. We're the only charity in the world that does 99 and 9/10% of what we do is free, including our super clinics, laser, ultrasound, dental, psychotherapy, eye exam, consultation, you name it. We are a one-stop shop, a one-stop shop for vascular birthmarks. So Liv says, my daughter has what we believe is some stubborn eczema on her port wine. We see that a lot.
Yeah.
I've tried several types of steroid, hydrocortisone creams, which smooth the skin, but they don't clear up the redness. the areas of eczema are much darker red than the actual clearance we've seen from, and I hear that too. The area
Yes.
gets darker than it looked with the port wine. Do you have any advice for how we can eliminate the eczema? We are taking a break from treatment. Is it likely to self-resolve?
Yeah, it will eventually, but it may take a very long time. So what I suggest my patients to use in these cases is VEA cream. This is a cream, it's made in Italy, but it's available worldwide, and it contains vitamins, vitamin E and vitamin A, and it is very effective in helping with the eczema. Also, there is some literature, or although scant, so don't take me as a Bible in this case, but some say vitamin E and vitamin A on themselves help clearing capillary malformations, port wine stains. So VEA cream is what I would suggest to try in this
You
case.
mean it helps clear the eczema that's on the port wine, not the port wine?
No, they say the port wine.
No, you
For
mean
reason,
the eczema. It doesn't make the port wine go away.
it clears it somehow. There is
Huh?
literature on this, yes.
You better send me that literature.
I will.
I want to read that. Okay, so okay, I can't read the name. And I think it might be Greek. Hello, Dr. Colletti and Dr. Linda. We had laser treatment on Maria on the 1st of December. She has segmental hemangioma on the whole left side. I remember her,
Yes.
precious, beautiful little baby girl. It's been a little more than 2 weeks. The dark spots and the laser spots are gone, but we don't see any difference on the hemangioma color. What effect should we expect? And is it necessary for the red to fade before the plastic surgery?
Okay, so 2 weeks is usually too little a time to judge the effectiveness. We usually wait until the fourth week. Moreover, it is not necessarily said that one treatment will make things so different. PDL dye laser is a procedure that has to balance benefits and risks. So you don't want to go too high with the energy and cause scarring, but you will try to reach the plateau, the sweet spot where you are being effective without causing damages. So you may want to come back and try with higher fluencies, for instance, or just wait a few more weeks to see when the purpura and the redness fades away, how the results are.
Thank you. Jillian says, hi, Dr. Colletti. I have a low flow venous malformation on my face on my right cheek. I've had sclerotherapy with bleomycin, debulking surgery, and even tried sirolimus for a year. Do you have any suggestions for what else can be done? I'm willing to travel anywhere in the world for help with this.
Okay, so this is a very nice question because it allows me to say something that I believe is critical. So when you say I had sclerotherapy, okay, you are saying something like I went from Milan to Rome. You can go from Milan to Rome walking. You can go by car. You can fly from Milan to Rome. So it depends highly on the operator. I mean, the results are dependent on the operator because we can use different sclerosants and they have different results. You can be more or less aggressive, and I am rather well known of the world to be pretty aggressive with sclerotherapy. But this is probably why the results I think I see, and I believe Dr. Linda can confirm this, are quite encouraging. Same holds true with surgery. You say you have undergone surgery, and then now I'm telling you, a surgeon is like a sculptor. Okay, it doesn't. It's not enough to have a scalpel. It depends on you, on your knowledge, on your experience, on many things, and also to help with results in venous malformations, there are at least two techniques that can be used. The first one, I published it, is called the strangling technique. And the other one consists in injecting a glue into the malformation prior to doing surgery. And when you do this, you are able to get in surgically and debulk it to much in a more aggressive way, effective way than you would do with just surgery, because the bleeding in a venous malformation is horrendous if you didn't do so before. So I think I definitely can help you. Contact me via email again.
His email will be posted for you, Jillian. It's pretty easy. It's giacomo.colletti@gmail.com. But it's here. I can see it in the stream. So if you just look down, Jillian, you can see it. Send him whatever records you have. If you have any discs or any of your imaging that you can electronically send to him, that's always good too, for him to see that. So thank you for that. And yes, I have seen his results and they are superior. Okay, the next one comes from Claudia. Oh, she said there was no medical treatment for his leg length discrepancy. It just seems to have normalized. Has anyone ever done any research on the trauma effects of laser on a child's development? Aurelius had 9 treatments before he turned 1. He's now 4 and has been diagnosed with autism type 2. Dr. Geronimus did a study, a longitudinal study on this, and found in his database, which is the largest in the world for treating port wines, that there was no long-term sequel with cognitive impairment or psychosocial development as a result of the laser treatment, or no way to prove it. You know, I mean, kids are exposed to many traumas like vaccinations or tonsillectomies that were unexpected or whatever. But I don't know if you want to address it, but I, basically mentioned.
No, at least I can say that there is no data that suggests that laser, awake laser in babies with port wine stains will cause any issue on the neural development. So I've
never heard of anyone in 30 years, quote, developing autism. And I have 3 half brothers with autism, so I'm very familiar with the spectrum, but I've never heard of it in 30 years. So unfortunately, it sounds like a double hit.
But I saw diffused capillary malformation associated with autism. On the other hand,
well, Dr. Comey has published on that with Sturge-Weber and autism, when there is an intense facial stain in that region.
Yes.
So we know that. Okay, we have more questions coming in. So Jill Tice says, my 4-year-old daughter has a port wine stain on the left lower side of her face, her ear, and her neck. Last year, I noticed that the inside of her cheek and lower gums on that side, as well as her tongue, are getting darker red than the rest of the areas. She has been receiving PDL 1.5 years. Should I be concerned about the darkness on the inside of her mouth, since it's on the same side as the port wine?
It is very likely that your daughter has the capillary, the malformation in his floor of the mouth, mandible, and tongue too. That would not surprise me. I saw plenty of cases, of similar cases. But that should not worry you, because most of the patients, most of the stains, the deeper seated ones, will not cause any trouble. But they can be lasered, especially the mucosa of the cheek will respond pretty good to laser. At the same time, I would suggest not to treat the gums, because PDL can damage the gums. So
the teeth.
Yes, so do have the mucosa treated with PDL, but not the gums.
Thank you. And while I'm waiting for the next question to load, one of the things I wanted to let everyone know is, in the 5 years that I've been working closely with Dr. Colletti, quite a few people, including myself, have made numerous trips to Italy to be treated by Dr. Colletti. And a lot of people think it's a big deal, but I fly out of Newark and New York City, round trip coach, $600, $700. I stay very reasonably in Milan, in walking distance to Dr. Colletti's office, and his fees are so much more reasonable than the US. So I don't want anyone to have that fear or deterrent thinking, oh, how am I going to go to Italy? Because you definitely have a lot of US patients coming to see you. I know, because I'm managing them, and I just want everybody to know that, because I know that I don't know, she's been Jillian, I think it's Jillian. Yeah, she's going to be contacting you. So I just wanted her to know if she's coming. Yes, so she'll be contacting you ASAP. Okay, so we still have 19 minutes, 20 minutes left. Looks like we're barreling through all these questions. Oh, okay, so all right. Kimberly says, my 9-year-old son has a very stubborn port wine stain in the V2 area. He's had 25 lasers, and the first was done at 5 days old. Bravo, bravo, mom. He's had a total of 10 before age 1. We have not seen much improvement. Do you believe you can offer better results? We have had treatment through U of M Mott. I know about Mott. I don't know. We don't refer directly to there. I can't speak for their laser experts, but they're not in my top tier with Geronimus, Nelson, Goldberg, that group. So I can't speak to that, but maybe you can address.
The first thing I would do would be an ultrasound, just to be sure. It's not typical for a port wine stain to respond so little to PDL. So I would very much investigate it, dig deeper with at least an ultrasound done by an expert in vascular anomalies. It's not enough to have someone do an ultrasound of that area.
And also I would, we have our free conference every year. It's going to be October of this 24. And everybody who comes tells me, why are the clearance is so much better when Dr. Geronimus does it than my doctor? Well, it's multiple factors: settings, device, and technique. And you can take the settings and you can take the device and bring them to your doctor, but there is the technique factor that can't be transferred. Thankfully, Dr. Colletti's training in the laser was under Dr. Geronimus and Dr. Nelson. It doesn't get any better than that. So when you get a laser by Dr. Colletti, you're getting it really from a Dr. Geronimus, Dr. Nelson type of protocol, correct? You follow their protocol. So I question the user, especially on a 5-day-old baby. Usually they're very reluctant to use the proper settings, where Dr. Geronimus hits the babies really hard and aggressively within the first month or two of life, other doctors tend to think baby, delicate, and they set the settings really, really low. And that's not, it's the opposite, correct?
Yeah. You shouldn't do it like that, because the very first sessions are usually the ones which give the most beneficial clearing. Then you will obtain some more clearance, but you should always, or at least this is what I learned from the best, from Dr. Jones and Nelson. You start hard. You don't go soft.
Right.
Not
So
even at the beginning.
I'd have to find out, you know, she can write to me. My email is it'll appear in this string here. It's vbfpresident@gmail.com. I'd be interested to know the settings and the device that was used. That's just from my perspective. Another question on port wine and eczema. We've been lasering her with the eczema when it is smooth. Is it okay to do this, or should we stop until the eczema is fully cleared?
There is no science behind the answer that I'm going to give you because it wasn't published. In my opinion, when there is eczema, I don't treat that area, but it won't harm your baby to treat even that area. It will not be effective though.
I know that Dr. Nelson does treat through the eczema because I've asked about it, and his opinion is, well, the eczema will clear up eventually and the laser will address the capillary malformation. So he just barrels through. But I know sometimes Dr. Geronimus will take a pause when there is the eczema, mainly because it freaks out the parents to see the red when you're trying to address red, and you can't explain to them that's not the port wine, that's the eczema, because they write to me and say, why does it look worse? And I'm like, can you feel it? Does it have like a texture to it like the eczema? Okay, so so Kimberly wants to know who you recommend for the ultrasound. That's a good question. The only place that I know that does good diagnostic ultrasound for vascular anomalies in the US is Grisham Richter at Arkansas Children's. He's the only one that I know. I don't know, do you know of anyone else in the US that's doing
I'm not sure.
definitive ultrasound with that? Yeah, so that's the only one that I can, unless you, next October, Dr. Colletti will be in New York. We'll have our free ultrasound clinic. Unfortunately, I'm not sure if he'll be, we do have to talk too about the AVM meeting and the next super clinic in Italy. We get dates on those, and you may actually be doing a second ultrasound clinic in the United States if we do that. So stay tuned. So I don't know what, I can't say the name, but they said, hello, our child has a venous malformation on the face, the eye, and the head. I want to ask if you are coming to Germany.
No, I'm not coming to Germany, but Germany is not far away from Milan.
Short ride, short flight. A short flight, right? And you know,
contact me, email me, please, so we can know better what we are dealing with.
Yeah, and his email is in here. And you know, remember too that a lot of people, you know, we get an expert like Dr. Colletti, okay, AVM. It would be wonderful if I could put him in a suitcase and take him to the state of every patient I have that has an AVM, and open up the suitcase and he pops out with all of his tools and instruments and takes care of that patient. And then I put him back in the suitcase and fly to the next state. But that is not how medicine works. He's not licensed. We are looking into a slight possibility of trying to get him credentialed in the US, but as of today, he's not. So you have to go to Italy. You can get a consult with him for free at our conferences, and anytime he's with me, we do a free consultation clinic. So it doesn't matter where we are. We were at a ISFA meeting in Boston last year, and we did a consultation ultrasound clinic. We were at a laser guidelines meeting in Marlborough, Mass, and we did an ultrasound clinic. So whenever he's with me, we do an ultrasound clinic. So just watch the VBF website, look for when our conferences are with Dr. Colletti, and you'll be able to come and get a free ultrasound, or you can go to Italy and, you know, discuss with him. If you do a consult with Dr. Colletti, when you do that consult, which he does his lasers and consults on Friday at laser class, correct? You do a lot of them. For that one fee, which is very reasonable, you can get laser and ultrasound and consultation for one affordable fee. So it's worth it, because then you get the full picture and then you can decide what you need to do after that. But getting that definitive diagnosis with his particular ultrasound, and then getting the proper plan outlined of what it would take, doesn't necessarily mean 100% of the time you'll go to Dr. Colletti, but it does mean you'll have an accurate diagnosis and an informed treatment plan. If he says this requires this, like you said, there's many ways, and you forgot train, to go from Milan to Rome. There's many ways, right, to go from Milan to Rome.
Well, helicopter as well.
Well, and also you can take a Porsche and drive 250 kilometers per hour and get there quicker than the train.
Yeah.
Right?
Yeah.
So there are many ways to get to the end, but when we do our consultations and we do our clinics, you get an accurate diagnosis and the treatment options outlined. Then you do your part, you do your homework, you do your research, and you make a decision for you or your loved one what that best treatment plan is going to be. Okay, so let me just see the next questions as we're winding down. Sally says, my son has a lymphatic malformation. He's 39 years old. He's had 26 surgeries, and now it is growing in his throat. Do you use laser on a lymphatic malformation such as this in the throat?
I do. I definitely do. Actually, I am about to publish my personal case series on 26 patients with low flow vascular malformations of the airways, complex ones. And again, I do have my personal protocol, which is based on local injections of bleomycin associated with laser, and if it's the case, with a new device called J-plasma. So yes, I do that.
Thank you for that. And hello, Dr. Barcote. So Dr. Zoran Barcote from Croatia is on. You need to come to Milan and hang out with Dr. Colletti, because all your patients, so many of your patients go there for our free laser. And I know Zoran's been trying to get like some kind of vascular.
You'll be more than welcome.
Yeah, come. You can go to Milan anytime and hang out with Dr. Colletti, or come to our free clinics. Okay. So thank you for that, Gina. She's tagging on how we just discussed this case of lymphatic malformation, and she's letting them know we have the booklet that we did on lymphatic malformations that they may want to go. So that's a great tag team approach, Gina, much appreciated. Thank you for that. And Sally said, thank you. Just remember, Sally, because Dr. Colletti said he can laser the airway with a lymphatic malformation, it doesn't mean you can go to a laser expert like, you know, Dr. Nelson or Dr. Geronimus, because they don't do airways, okay? They don't do that. You have to make sure you have the right doctor. Usually for the airway, it's a surgeon, because the dermatologists just really stick with
an
the
otolaryngologist or a maxillofacial.
Right. So I was going to say that surgeons can be plastics, facial plastics, ENT, maxillofacial. They can be pediatric surgeons, but it's a different approach. So if you do want to have your son properly lasered in the airway and it seems like this has been problematic, make sure you go to the right laser expert. If not Dr. Colletti, then go to our website and find who is an expert in lasering the airway. I know that Dr. Darrow has done it in Virginia. And I know Dr. Hockman has done it in Charleston, and I believe Dr. Richter has done it in Arkansas, but I'm not positive about any, and they may do it at Boston Children's, but I have not heard of it being done there. So just make sure when you're choosing who to go to that you're choosing someone that actually knows how to do it. That's one of the things about VBF is we want you to see the best. We want you to get the best. We want you to see the best because it's your loved one. Okay, your loved one. We have our A list and our B list and our C list, and I don't even use the C list. Okay, so I don't do referrals unless I know who they are, because I take it very serious who VBF refers people to. So we only have 5 minutes left. As I mentioned right from the beginning, Dr. Colletti has been doing phenomenal work with this new way of addressing high flow and low flow, venous, lymphatic, but mainly AVMs and venous with this new electrosclerotherapy. Shaza is writing, for the lady in Germany, we travel from the UK to see Dr. Colletti. It is certainly possible, and I would 100% recommend. Thank you to the VBF. Without them, we wouldn't have accessed the clinic or have known to be able to come to Dr. Colletti. Our boy has had brilliant clearance so far, forever grateful.
Thank you. Thank you so much.
Makes my day as well.
Thank you so much.
Because we're both doing our job, right? Both of us. Mari Hani wants to know, how often would you recommend laser treatment for kids over 2 years old? My 2-year-old has had 24 treatments, but she is getting very anxious and we've been taking longer breaks, 3 to 4 months. Not sure if that's recommended, but if she's getting anxious, I'm surprised. I mean, she made it to 2. So now, and you talk about this, right?
Yeah, I usually, the thing here is that your baby must not remember anything. I mean, until the age of 2, there is no or very little long-term memory. Okay, so you can do the laser without anesthesia until the age of 2, but I usually don't do it after that, and I suspend from the age of 2 to the age of 3. And if it's the case, I resume at the age of 3, but I use sedation in that case. And of course, being sedation needed, you will not do it more than 2-3 times a year.
So basically, when they get to that age of being anxious, that's them telling the parent, this isn't good. And that's when the parent has to make a decision. There are multiple forms of anesthesia, some very short-term, short-acting. Dr. Nelson uses it quite a bit. He uses a cocktail, some kind of conscious sedation for children. I'm hoping that we improve some options for some pain. I don't want to use the word anesthesia, but some ways of managing pain that's not going to cross the brain barrier. And you know that I've been searching and seeking for this solution because we know the paper on multiple general anesthesias before age 3 recommends not to do more than 3 general anesthesias before age 3. So this is why this is a critical period for parents when that's why we really want you to get those babies in at birth and hit them hard. Dr. Geronimus is doing 2 treatments a week now, 2 a week on newborns. And he's getting ready to publish if he hasn't already, but yeah, it's going to be great. Let me see, did I ask this one? Okay, so anyways, that was the last question from Mari regarding the, and I think that's a good ending, which is, you know, how to take care of our children so that down the road, this isn't a bad memory, right? We don't want them to
Right.
have that. We don't want them.
Exactly.
Is it worth it? I don't know. Like, we want maximum clearance because the skin responds better in infancy. The baby
Yes.
won't remember it
Especially
in
newborn.
infancy. And you minimize the bullying if you get the maximum clearance in infancy. Now, the rest of it is really important to understand at what, I'll use the Kenny Rogers song I say all the time, when to hold them, when to fold them, when to walk, and when to run. And that's the job of the parent, right?
Yeah.
The parent has to make that
I
decision
agree.
based on, and in one of my presentations, I talk about the twin studies where one twin responds completely different than the other to pain. We have to remember that. And you have three children. And, you know, people may think your son is the rough and tough one that can fall down and not cry, but it's probably your middle daughter,
Yeah.
the one who's the daredevil, right?
Yeah.
The middle daughter is the daredevil. So you gotta judge by each child what they can tolerate and make the best decision for them. So, all right, everyone. Phenomenal session, Dr. Colletti, as usual. It's 12 o'clock.
Thank you.
What a wonderful way to end 2023. I will have to say that it
Definitely.
hasn't been my favorite year. There's been a lot of wonky things that went down this year. So my expression is 23 can flee, but for 24, I want more. I want more VBF. I want more sunlight. I want more improvements for our families. I want more treatment options. I want more clearance and less pain. That's what I want from 24. I want more. And also 24 marks the 30th anniversary of VBF. So
I
next
know
year
very
is
well.
going to be a great year. Thank you for doing this with us. As always, Dr. Colletti, it's wonderful.
Thanks to you.
You're so great with our families. They all love
They
you.
are with me, actually. They are with me. They
Yeah.
give me so much.
They love you. VBF loves you. You know, we're your other family across the pond. And Merry Christmas to you and your family, and Happy New
Happy
Year.
New Year.
And we will see you in 24 when we have more. Take care.
Bye.